Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Dominic Cardy, Minister of Education and Early Childhood Development. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et le ministre de l'Éducation et du Développement de la Petite Enfance, l'Honorable Dominic Cardy. Dr. Russell.
My glasses. Okay, there we are. Thank you, Bruce. Merci, Bruce. Good afternoon. Bonjour à toutes et à tous. Aujourd'hui, je discuterai de questions liées au voyage et j'expliquerai comment le virus responsable de la COVID-19 se transmet d'une personne à une autre et comment nous pouvons tous contribuer à empêcher que de nouveaux cas et de nouvelles souches de COVID-19 fassent leur entrée au Nouveau-Brunswick. Il y a bien été établi que le virus responsable de la COVID-19 ne peut pas aller bien loin tout seul. Simplement, se tenir à au moins 2 mètres des autres suffit généralement pour empêcher le virus de se transmettre à une personne à une autre. Le virus n'est pas très mobile, mais les gens, eux, le sont. Ce sont des déplacements constants des gens d'une ville, d'une province et d'un pays à l'autre qui permettent à la COVID-19 de se propager dans le monde entier. Today, I will be speaking about travel, how the COVID-19 virus moves from one host to another, and how each of us can help to keep new cases and new strains of COVID-19 from reaching New Brunswick. It is very well established that the COVID-19 virus cannot get very far on its own. Just 2 meters of physical distance between people is generally enough to prevent the virus from moving from one host to another, but not always, but for the most part. While the virus isn't very mobile, people are. And it's that constant movement of people between cities, provinces, countries that has enabled COVID-19 to spread to every corner of the globe. And in fact, at the national level, we actually receive mobile data that actually shows the movement of the population, and you can see that change when people are in lockdown phase versus other phases of their response. There have been confirmed cases in Antarctica where there are hardly any humans to actually carry the virus. So if we could all stop moving, like the global game of freeze tag, the virus would stop moving too. Of course that won't happen because our society and our economy depend on the movement of people and goods. But we can reduce the opportunity for the virus to spread by moving less and avoiding unnecessary travel within our province as well as the rest of the world. With every region of New Brunswick at the orange alert level, public health is strongly discouraging all unnecessary travel between health zones. Cette semaine, le cabinet a approuvé des nouveaux règlements que doivent respecter les gens qui ont voyagé à l'extérieur de la province. Nous prenons ces mesures pour nous assurer de pouvoir surveiller les gens qui se déplacent à l'extérieur de la province de façon à nous aider le plus possible à attraper toute infection importée avant qu'elle puisse se propager. With COVID-19 cases, infections spiking across New Brunswick following the recent holiday period and our health system seeing the absence of many workers who are now self-isolating, it is vital that we do everything we can to stem the tide of infection. And that we can do by asking ourselves before we go anywhere, is this trip really necessary? Travel for medical care, child custody, or compassionate reasons approved by public health are considered necessary. J'annonce aujourd'hui qu'il y a 18 nouveaux cas de COVID-19 au Nouveau-Brunswick et ils se répartissent comme suit. Dans la zone 2, qui comprenne les comtés de Saint John, Kings et Charlotte, il y a 8 nouveaux cas. Dans la zone 3, soit les régions de Fredericton et du centre du Brunswick, il y a 7 nouveaux cas. Il y a 2 nouveaux cas dans la zone 4, soit la région d'Edmundston et Grand-Sault. Il y a un nouveau cas dans la zone 5, soit la région de Campbellton-Restigouche. Il y a présentement 143 cas actifs au Nouveau-Brunswick. À l'heure actuelle, personne n'est hospitalisé au Nouveau-Brunswick en raison de COVID-19. Ça, c'est des bonnes nouvelles. Cependant, il ne faut pas oublier que notre système de santé demeure très vulnérable lorsque le nombre d'infections augmente en raison des douzaines de travailleurs de la santé qui ne peuvent pas se présenter au travail, car ils sont malades ou ils doivent isoler. Today, there are 18 confirmed cases of COVID-19 in New Brunswick, and they are as follows. In Zone 2, which is the St. John, Kings, Charlotte counties, there are 8 new cases. In Zone 3, which is Fredericton and Central New Brunswick, 7 new cases. In Zone 4, which is the Edmundston, Grand Falls region, 2 new cases. In Zone 5, which is the Campbellton-Restigouche region, there is 1 new case. There are now 143 active cases in New Brunswick, and at this time, there are no COVID-19 patients in the hospital, and that is something to be thankful for. But please bear in mind that due to the dozens of healthcare workers currently off work due to illness or self-isolation, our healthcare system remains vulnerable during this spike of infections. And please remember that behind each of these case numbers is a person with family and loved ones who are deeply concerned for their health, as we are. Again, I ask that you keep these people in your thoughts and prayers today. Further to yesterday's report about 2 outbreaks in adult residential facilities, I can provide you with this update. At the Fundy Royal Manor in Hillsborough, 72 people, 47 residents and 25 staff were swabbed yesterday. At Parkland Riverview Centre, Canterbury Hall, 109 people, 52 residents and 57 staff were swabbed yesterday. 2 new positive cases were reported yesterday at Parkland St. John Tucker Hall's Lily Court. There are now 20 positive cases at Tucker Hall, 13 residents and 7 staff. Yesterday evening, the prompt team was dispatched to Foyer Sainte Elizabeth, a 50-bed nursing home located in Baker Brook. Following a confirmed case of COVID-19 on Thursday, January 7th at each facility, Public Health started an investigation at the facility, and contact tracing has commenced, and members of the PROMPT, which is the Provincial Rapid Outbreak Management Team, will be conducting testing of the facility's residents and staff today. Keeping our most vulnerable citizens safe is the reason why we have maintained a variety of border measures since the pandemic began. As the vast majority of confirmed cases of COVID-19 have originated outside New Brunswick, these measures have been key in our success in limiting the spread of this disease. We have enabled New Brunswickers to travel outside the province for work, which is very important for our economy. But we have to balance these benefits against the risk created by COVID-19, particularly the new strains from the United Kingdom and South Africa, which have recently been reported in several Canadian provinces. This strain is much more transmissible, meaning more people can catch it than the current strain. Des nouvelles restrictions sur les voyages non essentiels au Nouveau-Brunswick sont entrées en vigueur. Les résidents canadiens qui possèdent une propriété au Nouveau-Brunswick et ceux dont les membres de la famille résident dans la province n'ont plus le droit d'entrer au Nouveau-Brunswick. Il sera permis d'entrer au Nouveau-Brunswick uniquement pour le travail, les rendez-vous médicaux, les motifs de compassion et des questions liées à la garde d'enfants. New restrictions on unnecessary travel into New Brunswick went into effect at midnight Tuesday. Canadian residents owning property in the province or who have family members residing in New Brunswick are not permitted to enter the province. We've returned to the pre-June rule that unnecessary travel into New Brunswick is prohibited. We had an exception from June through Tuesday for non-residents to visit their family or their property, but that exception was eliminated on Tuesday. Travel into the province is permitted for work, medical appointments, compassionate and child custody reasons. New guidelines for isolation requirements will take effect as of midnight tonight. And just coming back to our new rules around travel, again, we are really concerned about the increasing number of cases globally in the rest of Canada and the US. And we are also concerned that the increasing number of cases will be increasingly linked to the new variant, which again is much, much more transmissible, meaning many more people can become infected. Les résidents du Nouveau-Brunswick qui reviennent dans la province après avoir effectué un voyage non essentiel doivent s'isoler pendant 14 jours. Individuals moving to New Brunswick must self-isolate for 14 days. Toute personne qui déménage au Nouveau-Brunswick doit s'isoler pendant 14 jours. Et tous les renseignements que je vous donne aujourd'hui sont tous sur notre site web et aussi on va envoyer des informations avec les médias sociaux aussi. So all of the information that I'm presenting you today will be on our website. There will be a summary sheet, one-pager that you will see with all of this information detailing what we're changing today. New Brunswick residents returning from working outside the province can be released from 14-day self-isolation, provided they test negative on their Day 7 test. This is a change from the previous option for the 5-day test to ensure we are not missing potential positive cases. They must also get an additional test between Day 10 and 12. Les résidents du Nouveau-Brunswick qui reviennent dans la province après avoir travaillé ailleurs peuvent être exemptés de l'exigence de s'isoler pendant 14 jours pourvu qu'ils obtiennent un résultat négatif au test de dépistage subi le 7e jour après leur retour. Il s'agit d'une modification à la procédure précédente de subir un test de la 5e jour pour nous assurer de ne pas manquer des cas. Ils doivent également subir un autre test le 10e, le 11e ou le 12e jour après le retour dans la province. Et la raison pour ceci, c'est on sait qu'après 14 jours, ça c'est le temps le plus sécuritaire pour finir l'auto-isolement. Mais par contre, c'est très nécessaire et important pour les gens qui travaillent qui voyagent pour leur travail, d'être capables d'avoir des exceptions exactement les 14 jours et avoir les tests avant les 14 jours. New Brunswick residents returning after working in another jurisdiction and continuing to work when back in New Brunswick can be released from work isolation, provided they test negative on their Day 7 test and require getting additional testing between Day 10 and Day 12. Les résidents du Nouveau-Brunswick qui reviennent dans la province après avoir travaillé ailleurs et qui continuent de travailler à leur retour au Nouveau-Brunswick peuvent être exemptés de l'exigence d'isolement, sauf pour aller travailler pourvu qu'ils obtiennent un résultat négatif au test de dépistage qu'ils subiront le 7e jour après leur retour dans la province et qu'ils subissent un autre test le 10e, le 11e ou le 12e jour après leur retour dans la province. New Brunswick residents returning from a medical care appointment from another province along with their accompanying support person can also be released from work isolation provided they test negative on their Day 7 test and require getting additional testing between Day 10 and Day 12. This is a new requirement. And ideally, everyone would self-isolate for 14 days because that is the safest length of time to self-isolate to ensure that nobody is transmitting COVID-19 into the province. However, we are making these exceptions around the testing because of the nature of the travel. Les résidents du Nouveau-Brunswick qui reviennent dans la province après un traitement médical dans une autre province peuvent, tout comme la personne de soutien qui les accompagne, être exemptés de l'exigence de s'isoler pourvu qu'ils obtiennent un résultat négatif au test de dépistage qu'ils subiront le 7e jour après leur retour dans la province et qu'ils subissent un autre test le 10e, le 11e ou le 12e jour après leur retour dans la province. Il s'agit là d'une nouvelle exigence. Non-residents coming to work in New Brunswick must complete 14-day isolation. Again, that is the safest time frame for self-isolation to prevent the transmission of COVID-19. Les personnes ne résidant pas dans la province qui viennent au Nouveau-Brunswick pour travailler ont l'obligation de s'isoler pendant 14 jours, sauf pour aller travailler. International travelers, including temporary foreign workers and international students, must complete 14-day self-isolation and undergo a Day 10 test. We saw this work exceptionally well last summer when we introduced this. Les voyageurs internationaux, y compris les travailleurs étrangers temporaires et les étudiants internationaux, doivent s'isoler pendant 14 jours et subir un test de dépistage le 10e jour suivant leur arrivée dans la province. Post-secondary students coming to New Brunswick to attend university from another Canadian province or territory must complete 14-day self-isolation and undergo a Day 10 test. Les étudiants post-secondaires qui arrivent au New Brunswick, d'ailleurs au Canada, pour effectuer des études post-secondaires dans la province doivent s'isoler pendant 14 jours et subir un test de dépistage le 10e jour suivant leur arrivée dans la province. Work isolation involves traveling directly to and from your work destination without making additional stops. Those in work isolation must wear a mask at all times, indoors and outdoors, avoid contact with vulnerable people, and maintain a strict one-household bubble when not at work. L'isolement, sauf pour aller travailler, signifie qu'il faut se rendre directement à son lieu de travail et revenir directement à son logement sans faire d'arrêt supplémentaire. Les personnes qui sont tenues de s'isoler, sauf pour aller travailler, doivent porter un masque en tout temps, tant à l'intérieur qu'à l'extérieur, éviter les contacts avec les personnes vulnérables et respecter rigoureusement les critères de la bulle d'un seul ménage lorsqu'ils ne sont pas au travail. I must remind everyone that self-isolation requires you to be as separate as possible from others, and really and truly, the safest way to self-isolate is in an entirely different place than your household. If you can stay in a rented facility or an unused cottage, an Airbnb, that would be great. If you can't, then separate yourselves from others to the greatest extent possible. Do not share a bathroom, stay in a separate room. Do not share eating areas or utensils or personal items. Keep away from family and friends until your isolation period is over. Anyone coming to New Brunswick or back to New Brunswick after international travel or unnecessary domestic travel are required to self-isolate completely separately, either in a hotel or another dwelling place, complete with bathroom, kitchen, and bedroom. Everyone who tests positive, plus their contacts, plus everyone required to self-isolate is required to answer questions from public health on their symptoms, their travel, and their contacts. And I just want to highlight that over the holiday season, there were people who chose to self-isolate with their family members. Subsequently, some of those people did become infected, and they weren't really happy about the fact that they then had to extend their self-isolation another 14 days after that. So be very clear, I'm being very clear about this, that people who are self-isolating need to stay completely away from people. Again, in a separate dwelling would be ideal. Complete and truthful answers are absolutely critical to limiting the spread of COVID-19. And anyone who refuses to answer or whose answers are false or incomplete is now subject to charges. This came about as a result of regional investigations with our public health nurses who do the contact tracing, and they were extremely concerned about not receiving truthful information from people they were interviewing. And honestly, that kind of obstruction to an investigation can harm other people, can subject them to the risks of COVID-19, and obviously we know that with COVID-19 you can become hospitalized if you are severely ill, and we know that we have had deaths in this province. So we are taking this extremely seriously, and we need you to as well. I must remind everyone that self-isolation requires you to be as separate as possible from others. These measures are being taken to keep everyone safe. And really, some of these things may seem inconvenient, but really they are small in comparison to what COVID-19 can cause with respect to illness, and it will save lives. And it will save livelihoods as well, because we know that the more severe outbreaks are, the more people that are infected, the more people that are hospitalized. Again, it can mean that people can't work, obviously, and that is a problem with respect to the social determinants of health and all the things that we need in our lives to stay healthy. We are moving forward with our vaccination program and working diligently to get the COVID-19 vaccine into New Brunswickers as quickly as we can. Since the first vaccines are fragile and require ultra-cold storage, we were at first limited to where they could be provided. Cette semaine, nous avons reçu des congélateurs supplémentaires pour les hôpitaux régionaux à Fredericton, Edmundston, Campbellton et Bathurst. Nos équipes pourraient ainsi accélérer le processus d'immunisation dans l'ensemble de la province. Je suis au courant qu'il y a des gens qui ne sont pas nécessairement contents avec nos priorités, les protocoles avec les immunisations au niveau de les phases. Et je veux vous dire que toutes les informations qu'on a reçues pour faire la planification de toutes les parties de notre programme ont été faites depuis maintenant, d'ici jusqu'à l'été passé. C'était un processus très complexe et avec beaucoup de difficultés, mais la planification, la manière que ça déroule maintenant, c'est exactement la manière qu'on l'avait planifié. Mais on sait qu'il y a des gens qui sont très inquiets de recevoir leur vaccin tout de suite. Il faut attendre. Je sais, c'est vraiment difficile de vous patienter, mais c'est ça que je vous demande maintenant. I know there are people who are really anxious to get vaccinated, and on the one hand, that's a great problem to have because that means that people are really interested in getting their vaccine. However, the way we have done our planning, which started last summer, with all the complexities of logistics, distribution, all of the input from the National Advisory Committee on Immunizations. We've really put a lot of thought and care into the rolling out of this program. So if people can just be understanding that we have our phases in place, we are receiving vaccines in a very small, limited amount at a time, and once we get a larger amount later on, hopefully by June, then we can see a larger rollout at that time. So in the meantime, if we were to get more vaccines sooner, be assured that we would be rolling out much, much quicker. We need everyone's cooperation and support if we are to slow the pace of this outbreak and move New Brunswick back to the yellow alert level in our recovery plan. Because we have done this before, I'm confident that this can be done again. And just in closing, I just want to tell everyone, please get the app. We are at a critical juncture right now, and if every single New Brunswicker were to get the app today, I can tell you we would dramatically reduce the number of cases of COVID-19, because the way the app works is when you test positive and you get the code number from public health and you input it, every single close contact that you came in touch with who has the app also will be notified immediately, which means they can self-isolate immediately, which means if they have symptoms, they can get tested immediately. I need everybody to stay home if they have symptoms. I need everybody to get tested if they have symptoms. This is what's going to help us succeed right now, especially those people who attended New Year's Eve events. We know that we are expecting to see a blip in the number of cases over this weekend when we look back at how many days have passed since those New Year's Eve gatherings. We need people to wear masks. We're still seeing transmission in workplace settings where people could have been protected if they were wearing their masks. So please wear your masks. It works. Please remain 6 feet apart. Please self-isolate safely. There are many places to get information on how to self-isolate safely. We are seeing risks to people in households of people who have traveled from outside New Brunswick. We are also seeing risks of people who have been identified as close contacts of cases who then go on to become COVID-19 and then infect their household members. So please take this very seriously and self-isolate as safely as you possibly can. And also, vaccines are coming. We need to have your patience as that happens, and you will get your turn. And for everybody in the province right now who's doing everything they possibly can to help us get back to the yellow phase, virtual high fives. Thank you. Merci.
All right. Good afternoon, everyone. Bon après-midi, bienvenue, bonne année. Happy New Year to everyone. It's, despite the challenging times we're going through at the moment, a good time to remember the incredible blessings we have to be Canadian, to be here in New Brunswick, especially seeing around the world, seeing Los Angeles County as they're having to triage people to get medical care, even people who are dying at home because they can't get the medical help they need. In London, declaring the equivalent of a terrorist attack to deal with the overflow of cases. And here in Canada, as we see cases every day that exceed by factors of 10 the total number of cases that we've seen here in our province. Our friends in the US having to deal with the twin crises of a nearly unmanaged pandemic in many cases and the horrifying assault on democracy that we saw at the Capitol building the other day. Here at home, we still have a long way to go, as Dr. Russell has put it. We have got an increase in cases, but we know that we can control that. And we know we can control that. We know we can get back to yellow, and we know we can put this pandemic behind us because New Brunswickers have shown that they're up to the task. And I'm standing here as concerned as I was in March because we have new variants, as Dr. Russell has talked about. In addition to having those new variants, we also have nearly a year of grinding through this horrible pandemic. Nearly a year of people obeying in nearly all instances, but also often getting confused and demoralized by the rules that have ever changed because the situation has been ever changing. And people who are just tired. So we'll talk about that a little bit. But in terms of today's update, we've got students at Besborough School, who are staying at home, stayed at home yesterday for an operational response day, and today they're learning from home. So this time we are hoping and anticipating that students will return on Monday, but a handful of those classes will continue learning online, and we'll provide further updates on that as the days go along. In addition, we have got 5 early learning and childcare centers in zones 3, 2, and 1 that have experienced positive cases. Toute notre planification et l'expérience que nous avons acquise depuis la réouverture des écoles en septembre a permis au système de collaborer avec la santé publique et de réagir rapidement à ces situations. Nous avons travaillé en étroite collaboration avec les districts scolaires, les écoles, la santé publique et d'autres partenaires au cours des derniers mois pour mettre en place des directives permettant de maintenir le système éducatif afin que les enfants puissent continuer à apprendre en toute sécurité tout au long de la pandémie. Our plans throughout have been based on the best evidence available, the best information that we can access. And the reason why New Brunswick has achieved such incredible world-leading results to date is because New Brunswickers have been on board with following the rules set out by Dr. Russell and by government. That's why we've got to stick with those rules. The alert levels, the triggers, the associated restrictions have all been developed based on public health's comprehensive risk assessments and the most up-to-date scientific knowledge available. Absolutely, they have changed, but they change only as the evidence suggests they must. And really, policymakers and experts like Dr. Russell and her team are left with a choice when the situation changes. To stand up and go, yes, things have changed, and this is why we're making these adjustments, or to pretend that everything's the same. And I know which province I want to be in. I want to be in a province led by experts and leaders who follow the advice, because we are seeing around the world daily in the mounting numbers of cases, the horrifying growth in the number of deaths, what happens when governments make the wrong call, when they put PR ahead of policy, and when they put trying to survive for another day or another election ahead of doing the right thing. So every time that a zone moves to the orange alert level, I get lots of questions from families on why we're not closing down the schools altogether. Go back to my point about trying to stick to standards that we have set, standards that have served us well to this point. It's because our return to school plan was developed to respond appropriately to the most current public health advice and those alert levels. And that means the measures we take for schools need to align with the advice that we're providing to the rest of the province. Alors aujourd'hui, toutes les écoles de la province se trouvent au niveau d'alerte orange. Cela signifie que le personnel et les élèves de tout âge doivent porter un masque à tout moment à l'école et dans les autobus scolaires. Le port des masques n'est pas obligatoire lorsque les élèves mangent, boivent ou participent à des cours d'éducation physique. Les élèves de la maternelle à la 8e année peuvent également retirer leur masque s'ils travaillent en silence à leur bureau. While a zone is in orange, students will not be able to use wind instruments or sing. Extracurricular activities, including interscholastic and extramural sports, are going to be limited to skills and drills practices within one team, precisely to minimize the airborne transmission that can make COVID-19 so dangerous. At early learning and childcare centers, learners will not be able to change groupings and will be actively screened before entering their building. Staff, school-aged children, need to wear a mask at all times unless they're eating or drinking. Children between the ages of 2 and 4 must wear masks in common areas, but can remove it when they're within their group. And all the information on the return to school plan and what to expect in different alert levels is available on the Department of Education and Early Childhood Development website. So I'd like to take this moment too to remind families that if there's a confirmed positive case or possible exposure of COVID-19 in a school or childcare facility, the families and the school community will be notified directly. And otherwise, no news is good news. We're confident in the plans we've prepared, and we're working hard to ensure that you are too. And as Dr. Russell mentioned, one of the best things that a citizen can do every day to help protect themselves and their families and their community against COVID-19 is to download and use the COVID-19 app developed by the federal government. It protects your privacy and it saves lives. Download it for free, Check it every day, and you'll get an alert if you've been exposed to someone else who also cared enough about their fellow citizens to download this app. So before Christmas, we tried to gather as much feedback we could from students and from teachers to try and look at ways that we can improve the second half of this extraordinary and extraordinarily difficult school year. And we know there's certainly room for improvement in the delivery of courses, especially at the high school level. And so on that note, I'd like to remind parents and students of some new services that are available. Des services de soutien informatique sont disponibles pour les élèves ou les enseignants et enseignantes qui ont des difficultés à se connecter pour l'apprentissage virtuel. Le numéro du centre d'appel Bell est le 1-833-453-1140. Des services de conseil virtuels, en plus d'une variété de soutiens et de programmes, sont disponibles dans nos écoles. Des ressources sont également disponibles sur le site web COVID-19. While so many other jurisdictions have faced widespread closures of schools, schools opening and closing often seemingly at random, our students have been able to continue receiving a quality education, additional supports, and opportunities to socialize and to care for their mental and physical well-being. The entire education system has undertaken so much work in collaboration with public health to keep our schools and childcare facilities open, healthy, and safe. So I want to take this opportunity to extend, as we go into January in the second half of this year, a special thanks to all the staff in the schools and in the early learning centers who have been impacted by confirmed cases or possible exposures or who are waiting for the day that that happens. Thanks to all of you for your patience, your guidance, your leadership, and your courage. From bus drivers to janitors to teachers to early educators to the people working in administrative roles. This has not been an easy time, and your resilience and dedication to the education of our students will not be forgotten. We know that situations where there are exposures or cases in a childcare setting or in a school raise concerns and anxiety. But that response, again, from the sector has been outstanding. And a moment as well to thank the parents who, in the face of the frightening news that there's a COVID-19 case in their schools where their children attend, that by and large, nearly every parent I've heard from has been thankful for the communication they received and has been as cooperative as they possibly could be. And I can't imagine the situation that those parents must be in. And the parents who haven't had yet to deal with a frightening moment like that. The expectation every day that one of these news conferences will reveal a case in their schools. It's the courage of all New Brunswickers in getting through this pandemic that has been the marker of our success and will continue to be as we get through this final phase, as we deal with the last-minute crisis of this new variant, but as we know vaccines are not just on the horizon, but here in New Brunswick, in freezers, getting into New Brunswickers' arms as quickly as possible. But if we keep on following the measures that we've laid out, we're going to be able to avoid extensive transmissions in schools and minimize the impact of the pandemic on learning. And that has always been the goal as far as the education sector is being concerned. We've been using a layered approach that includes keeping students in consistent, smaller groups, using masks, encouraging proper hygiene, and promoting physical distancing as much as possible. And I know people are getting tired. COVID fatigue is a real thing. Everyone is anxious to get back to normal. But right now, these plans, in place since September, tightened and modified as our experience of combating COVID-19 grows, making adjustments here and there, these plans have worked. We've been able, by and large, to keep our schools safe and open, and we've got to stick with this, because we can see the light at the end of the tunnel now, but now we've still got that last bit of track to ride down, but we're getting close to the end. So I need your collaboration to be able to keep our schools healthy, safe, and open. I will not hesitate, the sector will not hesitate to close schools if it's recommended by public health, if the appropriate triggers are met, if we believe there's a risk to the safety of our school staff and of course of our students. Of course, if we had to move to that situation, it would create enormous challenges for students and New Brunswickers. Le rôle principal du système éducatif est d'enseigner clairement, Mais la fermeture des écoles a également un impact sur la capacité de nombreux parents à travailler et joue un rôle dans le soutien de notre économie et des objectifs de santé publique. Notre système est mieux préparé que jamais à une fermeture, mais il y a aussi des services et soutiens essentiels qui manqueront considérablement aux élèves et aux familles en cas de fermeture. Lots of students and their families depend on the critical programs offered through our schools, whether it be supports for students with complex needs or accessing breakfast and lunch programs. Closing schools would put significant pressure on the childcare system, already overstretched, and on the families of frontline workers who depend on those services to care for the rest of us. And that's in addition to the routine challenges families face in supporting students when they learn from home. So everyone must cooperate to keep our schools healthy and safe for our students. That doesn't mean just folks in the education system. It means every single citizen of this province. If there's a little one you care for, whether it's a niece, a nephew, someone you're related to, or not at all, just someone you know and care about, this is up to you as well. Because COVID-19 does not discriminate between schools and office buildings, doesn't care whether you're at home or in the mall. It's up to each of us to take the necessary steps to keep this virus under control. So before Christmas, I had asked the education system to mask up voluntarily as we returned from the holidays. And I just want to say I was incredibly pleased with the supportive letters, including some great photos of classes sent in by teachers of students masking up throughout the day on Monday. Of course, the move to orange meant that we're now all masking up involuntarily, but you can see across our school system in New Brunswick that our teachers get it, our support staff get it, our administrators get it, and our students get it as well. And that's why these measures are having great success in our schools. And it's that sort of teamwork that we've got to try and keep up for the next couple of months, just a couple more months. Enfin, nous donnons l'exemple à nos apprenants. Vos actions et les risques que vous prenez déterminant si les élèves du Nouveau-Brunswick pourront continuer à recevoir le soutien et les services dont ils ont besoin pour réussir dans un environnement sain et sûr. J'encourage chacun à jouer son rôle pour mitiguer les risques autant que possible dans nos écoles et dans toute la province. We are doing all of this to get through this. Something that I think is often missed in our discussion around COVID-19 is the relationship between the government and the population. We are a small province, less than 1 million of us sitting here in the corner of the North American continent. The people in charge, Dr. Russell, the Premier, the leaders of the opposition parties who've left their mark in New Brunswick history with their contributions to the COVID committee that's helped guide us through this pandemic. Myself, folks in this room today, the journalists, we're all just regular people. And it's moments like this when democracies show their strength. Because we're going to get through this, not through a long list of government edicts and laws, but because you, as citizens of this province, decide that taking the right steps is in your best interests, which it is, your family's best interests, which it clearly is, in all of our best interests. Because this isn't some false dichotomy between healthcare and the economy. This is about making sure our hospital system isn't overwhelmed. It's about making sure that we can keep our students in school so they can develop into the fine young citizens we know they will be. And the choice about whether that happens, or whether we slide into something more difficult, more dangerous, and dark, is up to all of us. Me as a decision maker, absolutely. I take that burden seriously, and I know all my colleagues do as well. But every citizen, as Dr. Russell says, can decide whether you're going to go out this weekend, whether you really need to make that trip, whether or not you can ask someone else in the household to make an errand for you so that you can minimize your contact outside. Think about every single thing you're doing for the next few weeks so we don't have to think about these restrictions anymore in just a few weeks' time. New Brunswickers have shown leadership throughout this pandemic. Let's not lose sight now of the prize, which is coming out fully vaccinated, our economy intact, ready to face a changed world with all the challenges it will bring. I have got no doubt that we're up to that task. Merci beaucoup et bonne année. On va le faire.
Merci, Monsieur le ministre Cardy et Dr. Russell. Thank you, Dr. Russell and Mr. Cardy. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. And please ensure your microphones are placed on mute. Travis Fortnum, Global TV.
Hi there. My question is for Dr. Russell. We've talked a lot about how we're expecting to start seeing the results of New Year's Eve spread this weekend. I'm wondering if you'd hazard a guess at what those numbers might look like. Should New Brunswickers expect to see spikes similar to what we saw earlier this week?
Well, before I answer that question, I just want to acknowledge there's a little girl out there who's watching right now whose name is Reese, and she has put masks on her dolls. And I just want to acknowledge that that is a really, really safe thing to do. And good for you, Reese. Good job. With respect to New Year's Eve gatherings, it's hard to predict. I think that if we weren't in the orange phase, then I think the risks would be higher because whoever has been infected over that period of time has now had to stay at home in terms of their one household bubble. However, what I'm seeing with transmission in recent days are people who are not wearing masks in their workplace setting, so please do that. Originally, in the original Christmas gatherings, we were seeing people attend work and Christmas gatherings while they had symptoms. If you are having symptoms, the best thing to do right now is to stay at home, call 811, go online, do the self-referral, get a test. Get the app. The app, if every single person in New Brunswick, I wish this would go viral, somebody do a TikTok on this. I need everybody in New Brunswick to get the COVID-19 alert app. I know in Moncton recently, everybody woke up in the middle of the night with notices from the police saying there was somebody who was at risk of harming people in the community, and that information was instantaneously in every single person's phone in that area. If everybody has the COVID-19 app, then when somebody who tests positive for COVID-19 enters their code because they've got the app, instantaneously their close contacts will be notified. So that is something that everyone in this province can do, if you have a phone, obviously. So as of right now, it's hard to predict, but again, we're watching really, really closely. I think we'll have a better idea by Monday morning. And in terms of the way we've watched our number of cases increase, we have seen double digits all this week. I think what I'd be very happy to see is, peaking and plateauing and then coming down the other side of these outbreaks. But again, we have a ways to go, but if everybody does their part, then I know we're going to get there.
Thank you, Mr. Fortnum. Thank you, Dr. Fascarashnog.
Oui, bonjour. Ma question est pour le Dr. Russell. Comment il y a certaines activités sportives qui sont permises pour les enfants, pour les jeunes? Par exemple, les pratiques de hockey et d'autres sports. On sait que c'est difficile de faire respecter les règles de distanciation lors de pratiques. Pourquoi est-ce que ce genre d'activité-là est permise en ce moment pour votre
Vous demandez c'est quelles les directives pour les sports, pour les enfants dans la phase orange?
Non, c'est plutôt pour les pratiques de hockey, par exemple. Je me demande si vous pensez qu'il n'y a pas des risques qui permettent ce genre de pratique-là pour les sports avec les jeunes.
Bien, en général, toutes les situations, soit en jaune, soit en orange, soit en rouge, on a beaucoup de détails sur comment faire toutes les activités en sécurité, quelles activités sont permises, oui ou non. Alors, je sais que si vous voulez cette information, c'est sur notre site web. Et chaque organisme qui est en charge d'avoir des activités sportives, d'habitude, ils sont au courant à toutes ces directives-là.
Merci, Dr. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, if I heard correctly, you mentioned that charges could be laid when people deceive contact tracers. Can you elaborate on what that means and what led to that decision?
Well, because I received information from regional staff around the difficulty that they were having doing proper contact tracing as a result of people not providing accurate information, I really, again, was very, very concerned, and so were they, because if they can't reach people in a timely way to tell them that they've been in close contact with somebody with COVID-19, they don't know that they need to stay home and self-isolate, and therefore they continue to go out and about and do their normal activities that would be allowed in whichever phase that we're in. So it's very dangerous, because if that person infects people, if they work with vulnerable populations, again, these are life and death consequences, because people can die. It is now in the mandatory order for that reason.
Thank you, Ms. Hogarth. Marie Sutherland, CBC.
Hi, good afternoon. Question for Dr. Russell. You've been really stressing the importance of downloading the COVID-19 alert app this week. Do you know at this point how many people in New Brunswick have downloaded it? And I know you earlier said very few, but do you have a number? And is the app working to full capacity in New Brunswick? Because I get a message on mine that says, we'll let you know when you can report outside of Ontario.
Thank you for the question. Unfortunately, we don't have access to information at the provincial level as to how many people have downloaded the app. All I can tell you is in the investigations that have been happening over the last week, none of those people that I'm aware of have had the app, but again, that's the information that I received, and that's all I can share with you, because that's all I know.
Thank you, Ms. Sutherland. Rose Saint-Pierre, Radio-Canada.
Oui, la question est pour Dr. Russell. Est-ce que c'est possible de préciser qu'est-ce qui a mené à des consignes plus sévères pour les voyageurs qui veulent rentrer au Nouveau-Brunswick, ceux qui ont des résidences ici, ceux qui ont de la famille? Pourquoi est-ce qu'ils ne peuvent plus rentrer?
Oui, exactement. Une très bonne question. Je veux juste revenir à la question avant qui demandait au niveau de le app COVID-19. D'après moi, c'est quelque chose qui travaille très bien. My understanding is the COVID-19 app works very well. So again, I don't have the number of people who have downloaded it. I just am aware from contact tracers and from information from the regions that in the current investigations, there haven't been people that I'm aware of that had the COVID-19 app. So the more people that can get it, the better. My understanding, it works exceptionally well. So that's that question. Sur la question de les gens qui voyagent maintenant et pourquoi qu'on a changé les mesures, c'est pour trois raisons vraiment. Hein. La première raison, c'est parce qu'on veut diminuer les risques. Parce qu'on sait que plus que 95% de les gens qui ont le COVID-19 l'ont contracté en hors du Brunswick et ils l'ont voyagé ici, soit parce qu'ils travaillent, soit parce qu'ils voyageaient pour visiter la parenté, les proches, etc. Alors, n'importe quelle raison que vous voyagez au Nouveau-Brunswick, le risque est élevé que vous apportez le COVID-19 avec vous. Alors, c'est très important qu'on veut diminuer les risques et la seule manière qu'on peut diminuer les risques, c'est soit il y a moins de personnes qui sont permis de rentrer et les gens qui rentrent sont absolument, c'est nécessaire qu'ils fassent leur auto-isolement pendant 14 jours. Et pour ceux et celles qui travaillent, et c'est vraiment essentiel qui travaillent, ceux-là, ils vont faire les tests de dépistage dans la 7e journée de leur auto-isolement et ils peuvent arrêter l'auto-isolement après qu'ils ont reçu un test négatif. Et aussi, l'inquiétude au niveau le nombre de cas qui augmente tout alentour du monde, dans les autres provinces du Canada, à l'ouest d'ici, dans les États-Unis. Les nombres de cas augmentent tellement, c'est très sévère la situation tout autour du monde. Mais avec la complexité d'avoir un nouveau variant, celui du Royaume-Uni et aussi celui de l'Afrique, ces variants peuvent augmenter le risque de transmission tellement que c'est un danger qu'il faut protéger la population du Nouveau-Brunswick à ce moment-ci.
Merci, Madame Saint-Pierre. Laura Lyle, CTV.
Hi, thank you. This question is for Dr. Russell. Dr. Russell, when public health is going through the investigations into the new cases and doing this contact tracing, what are you finding? Are you finding that for the large part these are travel related, or is there something else?
So we have a really good picture of each and every case, all of their contacts. We actually have a visual representation of all the zones and what that picture looks like. So we kind of have some that are directly a result of travel and their household contacts. Then we have people who are part of clusters that were originally because of Christmas Eve gatherings where people were symptomatic and went to Christmas Eve gatherings, and then they infected their family members or work mates, and then they infected another layer of people. So the transmission chain has been happening that way in clusters around the province, and so that's how it's categorized at this point in time. And again, we're not seeing evidence of community transmission, but sometimes that can take 2 to 4 weeks to really determine.
Thank you, Ms. Lyle. Thank you, Dr. Michael Staples, Brunswick News.
Yeah, thanks, Bruce. This message is for Dr. Russell. Dr. Russell, the military has confirmed that out-of-province flights were provided for soldiers from the Gage over the holidays so they could spend time in other parts of Canada with their families. Did public health know about this, and what is your reaction to it?
I guess because the military falls under federal jurisdiction, they actually, they have their protocols. I think the only time public health has really had to be involved in a direct way was when people were doing their house hunting trips, and we were involved in trying to set up protocols for that. But my understanding with the travelers, again, I was aware indirectly through some other means that folks are traveling into New Brunswick of the military, but my understanding is that they are exempt from the requirements to self-isolate.
Thank you, Doctor. Thank you, Mr. Staples. Timothy Jakes, Campbellton Tribune.
Yeah, my question's for Dr. Russell. You just said you have a good background on the outbreaks in each zone by the tracing that's been done. Has public health determined if any of the cases in Zone 5 are the result of exposure to confirmed Quebec COVID cases, particularly exposure within New Brunswick? And if so, how many are confirmed or suspected to have been transmitted this way?
Well, in terms of the information that we have on all zones, we're really breaking it down into travel-related versus non-travel related. And for our purposes, it's really around whether there's community transmission or not, because that really requires a different approach. As you know, in some situations where we suspected community transmission, it would lead to mass testing in some areas. So for us, the information is really used for informing our decisions around what next steps and actions to take. And any of the risk assessments that we do around the contact tracing and risks that we're trying to manage is about educating the public on how to prevent this continued spread. So again, what we're seeing now is people who have symptoms who don't get tested, and that contributes to the spread. We have people who don't adhere to self-isolation protocols as strictly as they possibly can, which means that they put their household members at risk. And we're seeing people going to work when they have symptoms and infecting colleagues that way. And we also see people who are in workplace settings who may not know that they're infectious because they are asymptomatic at the time that they are at work, but they have been in contact with somebody with COVID-19 and they don't know that they're infected, and they're in a workplace setting and they're not wearing masks. So all of the information that we use, that we transmit to the public, is really about managing the risks and educating people on how to minimize them.
Mr. Jake Shelley Steves, Global News.
Yes, thank you. My question is for Dr. Russell. I have a question regarding the rollout of the second dose of the Pfizer vaccine this weekend in Miramichi. It's happening at that critical 21-day mark, which is not necessarily happening outside of the province, neighboring Quebec, for example. Pfizer has said they can't guarantee the efficacy of the vaccine at 95% outside of that critical 21-day window. So moving forward in the coming weeks, as the vaccine continues to roll out, are you able to ensure New Brunswickers who decide to get the vaccination that they can indeed get that second dose, within that 21-day period?
Well, we have had many discussions at the national level around the vaccine rollout. We have had direct presentations by the National Advisory Committee on Immunizations. There's so much detail around these vaccines that we are able to take that information and use it to inform our decisions here. We didn't really have any intention of changing the interval unless there was a need, for instance, for just alignment in terms of the way that we would line it up, or if there was some unforeseen circumstance around transportation, et cetera. But we don't have any plans to change very much at this time. And again, anything that we do is guided by information around, as you said, the efficacy, et cetera. So there are situations where people, as you said, in other provinces are making changes to that. But again, we have lots of consultations at the national level with Public Health Agency of Canada and Health Canada around all of these things. And the planning committees that we have here in New Brunswick have had extensive information and input around those pieces as well in terms of how we're moving forward in this province. But as of right now, our schedule, the way the rollout is planned, we're very excited. Obviously, those people that are receiving their second dose this weekend, I think by the time, I think it's a week to 14 days after that second dose that you reach that efficacy level. So there are going to be some people with really big smiles on their face in the next couple of weeks, which is really wonderful.
Thank you, Doctor.
Thank
Thank
you.
you, Ms. Steves. Tom Bateman, Brunswick News.
Yeah, good afternoon. Question for Dr. Russell. Given that we understand the UK and South African variants of COVID-19 to be more transmissible, are there plans in place to change or tighten any of the protocol or public health guidance in place now to ensure that the variant doesn't spread, through ways that weren't contemplated with the original strains? And I wonder if maybe Mr. Cardy could talk about this in the context of school as well. Thank you.
So, Tom, great question, and absolutely all the things that we're talking about today in terms of different travel restrictions are exactly for that reason. So in addition to increasing number of cases globally in the rest of Canada, in the US, we are also concerned about the fact that those variants, in particular the UK variant, is present in 30 countries right now. I did have a conversation with Dr. Theresa Tam today, actually, and we are on multiple calls during the week. And as of right now, there are only 3 provinces in Canada that have tested positive for that variant. We here in New Brunswick will continue to send any positive COVID-19 samples to NML, the National Microbiology Laboratory in Winnipeg. We did actually send 2 samples already that came back negative for that variant, so that's good news. But we will be continuing to be extremely vigilant around watching for it because the transmissibility is so much higher. So we are doing a lot of surveillance and keeping track of attack rates in any of the clusters that we're seeing. If we get suspicious, then we will be sending those results as well. And the turnaround time when we send those those samples is about a week.
Hey, thanks for the question. Yeah, obviously this is having an impact on all of our thoughts and actions. It gets back a little bit to what I was saying in my remarks earlier about how the new variant is in many ways it's still COVID-19, but it's a dangerous new twist on COVID-19 as a respiratory illness, the same way that COVID was a dangerous new twist on SARS and other respiratory illnesses we've seen over the years. And one of the difficulties now is because we're in the middle of responding to COVID-19, as we knew it last year, it's like, okay, well, we've got these measures in place, let's continue with them. Of course, we are going to, but we've got to recognize now that we're dealing with the potential of a variant arriving in our province, which is quite a lot more infectious than the original COVID-19 virus. And that means that the measures that we put in place will still work. It's still transmitted the same way, but the chances of someone getting infected from a more fleeting contact go up radically. Radically. We're seeing that. You look at the healthcare systems being overwhelmed in much richer places than New Brunswick. So when it comes to what we're trying to do in the schools, the reason why I focus so many of my remarks on the need for a civic response to this, to protect our schools, I could just as equally be in the position of Dr. Shepherd up here and saying we need to do the same thing to protect our healthcare system, or any other minister talking about protecting the people who they're responsible for. This is about all of us. If the measures that we keep in place are maintained and respected and they remain simple, don't travel if you don't have to. Don't go and talk to people if you don't have to for just the next few weeks. Wash your hands. Wear a mask. Maintain 2 meters distance. If we do that all the time for the next few weeks while we get vaccines in arms, this is done and behind us. And Lord, that will be a wonderful day. Alors, en effet, pour les écoles, oui, on connaît absolument que la nouvelle variation de COVID-19, c'est dangereux, beaucoup plus dangereux encore que l'ancienne version. Pas parce que ça tue un nombre additionnel, mais c'est beaucoup plus infectieuse. Alors, on a besoin de prendre les mêmes mesures, mais d'être encore plus sévère dans l'application des mesures mises en place par la santé publique. Alors, portez un masque, maintiens une distanciation sociale, lave les mains à chaque opportunité, évite les voyages, les rencontres qui ne sont pas nécessaires. C'est assez simple, mais en même temps, on connaît après les mois et les mois d'essayer de poursuivre ces mesures que les choses qui sont simples, ça aussi c'est difficile d'enlever les contacts, réduire les contacts, toutes les mesures qui ont changé la manière de notre vie. Mais on a juste besoin de les maintenir pour les prochaines semaines. Et après ça, avec les vaccins, on peut dire au revoir à COVID-19. Merci.
Thank you both.
Thank you, Minister. Thank you, Doctor. Mathieu Bois-Como, l'Acadie Nouvelle.
Bonjour, ma question est probablement pour la Dr. Russell. J'aimerais savoir selon l'horaire de livraison prévu jusqu'à maintenant, ce à quoi on s'attend, j'aimerais savoir à quel moment le Nouveau-Brunswick va commencer à vacciner les citoyens ordinaires, ceux qui ne sont pas particulièrement à risque, ne travaillent pas dans le système de santé, ne sont pas des citoyens de foyer de soins, et puis comment on va contacter les citoyens ordinaires pour leur dire que c'est leur tour individuellement de se faire vacciner.
Excellente question. Pour la plupart des gens, je veux dire, plus que la moitié de la population du Nouveau-Brunswick, ça va être environ entre les mois de juin et le mois de septembre, parce que ça, c'est le temps qu'on va recevoir la majorité des doses de vaccins. Alors, cette étape, cette phase de le déroulement de le plan de vaccination, ça va être fait comme vraiment presque exactement comme les vaccins pour la grippe. Alors, ça va être les pharmacistes, les médecins de famille, etc. Ça va être facilement fait avec ces groupes de gens. Et quand vous voyez chaque année, quand on fait les vaccins de grippe, c'est vraiment environ 350 000 personnes qu'on donne des doses du vaccin pour la grippe. Et d'habitude, on fait ça dans presque 2 mois. Alors, du mois de juin jusqu'à le mois de septembre, si tout va bien, puis on reçoit toutes les doses qu'on devrait recevoir à ce temps-là, c'est la façon que ça va dérouler à ce temps-là.
Merci. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, it sounds like a lot more testing will be required under these new travel and isolation rules. Can you tell us a little bit about what's being done to step up testing capabilities and avoid any backlog?
Well, the good news is we have great partners here in the province that give us a lot of data and information to help inform those types of decisions. So before we would even move forward with operationalizing this, we had our partners at Department of Public Safety help us with providing all the information around travelers that come in on a daily basis, whether they're work-related, whether they're for personal travel, non-essential travel, et cetera. So we had a really good idea of how many numbers of all the different categories of people who would be coming in and out of the province and would be requiring that test. So we do have capacity to look after those testing needs. And again, we have been working so well as a team, and I can't thank the people in Department of Public Safety enough for their cooperation and input, because again, we cannot operationalize things that seem really theoretically a good idea on paper. We can't make them a reality without the input of so many different individuals and organizations.
Thank you, Ms. McKinnon. Gilles Duval, TVA.
Oui, bonjour. Question pour la Dr. Russell. Simplement on sait qu'aujourd'hui, nous, au foyer de soins avec Brooke, il y a du dépistage intensif parce qu'il y a une bénévole qui a visité les lieux ces jours-ci qui est atteinte de la COVID-19. Alors, ça veut dire que même si les résidents ont été vaccinés en début de semaine, ils ont quand même été exposés au virus, j'aimerais savoir, combien de temps ça prend avant que le vaccin devienne efficace pour nous protéger et est-ce qu'il commence à protéger avant une deuxième dose là, qui pourrait survenir quelques semaines plus tard, s'il vous plaît?
Alors, je ne me rappelle pas quel vaccin qu'ils ont reçu, si c'était le Pfizer ou le Moderna. Moderna. Alors, avec le Moderna, le temps entre les deux doses de vaccin, c'est 28 jours. Et après la première dose, oui, il y a de la protection, mais la protection après la première dose, c'est seulement vraiment après 2 semaines. Après la deuxième dose, encore, ça augmente l'efficacité en plus que ça. Mais après la deuxième dose, il faut attendre encore une autre 2 semaines avant que vous avez vraiment le total montant d'efficacité que vous pouvez avoir avec le Moderna.
Merci, M. Duval. Mme McPhee.
Oui, bien, justement, si on conclut, ça veut dire que même si on a eu le vaccin cette semaine, il n'était pas protégé en conséquence.
C'est ça.
Merci.
Emma McPhee, Telegraph Journal.
Yes, my question is for Dr. Russell. I'm wondering where truckers fall under the stages for COVID vaccine rollout and whether there's a move to make them a higher priority.
So we have had many conversations, as I said before, at the national level around the prioritization and all the inputs for that. And then at the provincial level and also with our counterparts in the Atlantic provinces, I had a conversation with the chief medical officers of health this week from the Atlantic provinces. And because we are all in the same situation around truckers and rotational workers, et cetera, we are having those discussions around where they should be placed in the priority groups. And so we're sharing that information and looking at next steps for that. More to follow.
Thank you, Ms. McPhee. John Woodside, Alden, Brunswick. Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for Dr. Russell. You spoke a fair bit earlier about the vaccine and the rollout, and with that rollout likely expected to continue and the booster clinics set up for this weekend for those who received the initial Pfizer doses in December. I'm wondering what you can tell us about the province's plans or messaging strategy to encourage people to get the vaccine once it's more widely available. Like, what would you say to folks who maybe are, skeptical or on the fence about getting vaccinated?
Well, a couple of things. Number one, I'll start off by saying we have some information already around people's desire to be vaccinated. There was a survey done, and it showed about 75% of New Brunswickers would like to receive the vaccine. So that's number one. And that's a great number in terms of a target because at the national level, they're hoping that we can immunize between 60% and 70% of the population to have the amount of protection that we would like with respect to herd immunity. So as of right now, that looks great. And in terms of the number of doses that we're going to be getting in the next 3 to 6 months, they are quite limited. So those priority groups in the first 3 to 6 months are the most vulnerable in our population from a health perspective, but also from a workplace perspective in terms of who is going to be getting the vaccine. So by the time that we get to the months of between June and September, that is when we're going to get the majority, the large amounts of the doses of vaccine. And so on that note, with respect to those individuals, we do have a vaccine hesitancy communication plan already prepared. So we will be rolling that out in the coming weeks. And so that information will be available to the public and really help inform and help people feel more comfortable around receiving the vaccine.
Meg Cunningham, CHMA.
Good afternoon. My question is for Dr. Russell. A patient on one alerted their close contacts themselves when they tested positive for COVID-19. Do you endorse those who test positive alerted contacts on their own, or should they wait for contact tracing?
Well, we've had some trouble with people doing it on their own for a couple of reasons. One, the risk assessments that are done by the public health nurses assess what type of contact people have. So just because you have your list of names of people you were in touch with or spent time with in the previous time frame, the public health nurses will do the assessment about which of those individuals actually are considered a close contact based on risks, based on how close they were, whether they were wearing masks, how long they spent together, whether it was indoors or outdoors, et cetera. So the only downside to people taking that into their own hands in terms of notifying people is that they could notify somebody incorrectly in the sense that just because they thought they might be a risk and they conveyed that information to a friend or family member, it could heighten their anxiety. They could be self-isolating unnecessarily because they weren't told by public health to do that. So there are pros and cons to doing that. And again, we've seen that situation unfold, and some people have even put information on social media, again, which can cause some anxiety. So it's a bit of a double-edged sword, and we're happy to do the contact tracing. Obviously, with the COVID-19 app, that will be very helpful as well. So I think my advice to most people is to let the contact tracers do their work. Sometimes they do have difficulty reaching people, and that is a problem as well. But again, if people can download the COVID-19 app, that would go a long way into helping the outbreaks currently and diminishing the risks in terms of future outbreaks by getting it contained earlier.
Thank you, Ms. Cunningham. Aiden Cox, Daily Gleaner.
Hi, this question is for Dominic Cardy. So we heard from parents last spring when schools closed and pretty much schools education went into a distance learning model, just how it was sort of difficult to manage. I understand it was difficult for teachers as well because it was all just sort of abruptly thrust onto them. How has distance learning improved since it was first rolled out en masse last spring? And how standardized would it be in schools across the province if we had to see perhaps a phase red situation, at least maybe in one zone or multiple zones or even the whole province?
Okay, thanks for the question. I mean, I think I've done, I was trying to just count in my head how many briefings I've done on that particular subject, but anyway, happy to recap. So we shut down the school system in March on a moment's notice in the face of an emergency that we were not even at that point even beginning to understand. And several weeks later, made the announcement to end the school year because we didn't want to do what some other provinces, states, and countries have done, which we're doing and continue done, which is open and close, open and close. So give us the time to get this right for the fall. Made it very clear between April and June of 2020 that education being offered at a distance was suboptimal and in some cases inaccessible because students lacked access to technology, whether it was devices or connections to the internet. So since then, what we've done, we made sure over the course of the summer that iPads and other devices were made available to families that had students in the school system, at the younger ages especially, and made sure that they had access to an internet connection wherever possible. Recognizing that in some cases that was not possible because of the absence of service, not because of the inability to pay or access, we entered into discussions with ExploreNet, who have announced a rapid and radical upgrading of their services available across the province. Similarly, Starlink, now offering their service on a trial basis in New Brunswick, one of the few places that's offered. So we've seen competition emerge in the rural internet market, something that's fantastic and will help to address not just education challenges long-term, but hopefully as well help our province as we come out the other side of the pandemic and enter a world economy where distance learning and distance working are much more of a common feature. We also, recognizing that the high school students face a special challenge that every year, every month that goes past for them is critical. We made sure going into this year that we had a laptop subsidy program that offered subsidized high-quality laptops for all high school students below a certain income level and available at full price, still a very reduced price, for all families. And so we have fully wired high schools. We have students now able to access those fully wired high schools. Again, there are some very small number of cases where you're not seeing that because the internet connections just aren't there, but we're talking about a tiny number now. So we're looking to continue to improve access, improve quality. When it comes to the quality of online teaching, that's something which is a long-term challenge. Some teachers in March, in April, picked up that challenge right away and ran with it, and we're offering exceptional online learning immediately because they've been planning for this for a long time because it was their passion. Others picked it up pretty quickly, and others struggled, as you would expect. So as someone who this morning managed to not remember to take my microphone off mute for 2 Zoom meetings, I appreciate the challenges faced by those teachers who are less tech savvy than others. And we're continuing to work on that. The unions, the associations, the teachers have been very supportive. But it would be absolutely ridiculous for me to claim that we have a uniform standard at this point across the province. We don't have uniform anything across this province. It's part of being diverse is being diverse. It means some people are better at things and some people are not as good. So what we're facing right now is some teachers who would be ready to deliver award-winning, and I use that word advisedly, award-winning distance learning the second that schools have to go online, and others who will struggle. And all we can do as a system is reach out in a spirit of kindness and openness, recognizing that those teachers are also living in a point of challenge, the same way we all are, is offer them the support and guidance to be able to do the jobs as best they possibly can. Hopefully, our teachers won't get much practice in offering online learning this year. That, to me, would be the best possible outcome. En bref, on a fait beaucoup de mesures depuis beaucoup de mois maintenant pour augmenter la qualité et l'accessibilité à l'Internet pour tous les enfants et aussi d'augmenter les qualifications pour les enseignants-enseignantes, d'offrir la formation à distance. Et ça continue, mais c'est clair qu'on va voir si on a besoin de retourner en rouge, d'offrir l'éducation à distance. On va voir les écoles, les enseignants qui sont prêts pour aller rapidement en avant, et le reste qui va continuer d'avoir les difficultés. Et ça, c'est normal, et on va faire tout qu'on peut comme système pour adresser ces défis et célébrer les réussites. Mais la réussite la plus grande, à mon avis, serait d'éviter d'entrer en rouge et d'avoir la nécessité d'utiliser la formation à la distance en plein. Merci.
John Woodside, All New Brunswick. Before we close, Dr. Russell's going back to the podium to provide some more comments to several questions.
Hi there. So just to come back to the question about how many people have downloaded the COVID-19 app, the Canadian information that we have is that 5,930,699,000 people have downloaded the app. No, 5,930,000 people, sorry. That's how many people have downloaded the app in Canada, and that has happened in 9 provinces and territories, but we do not have the breakdown by province. Thank you. Pardon? Oh, one-time keys used, 13,697 provincially or nationally? Nationally. Okay, so it's been used 13,000 times. Okay. Sure. About hesitancy? Oh, okay. There was a question around vaccine hesitancy. And I did inform you that we do have a plan for vaccine hesitancy in terms of some communications. But just a couple of points on vaccine. I have spoken about the adverse events and in terms of the surveillance of adverse events for all vaccines, even prior to the pandemic. That information is available on the Public Health Agency of Canada website. And it is broken down by each individual vaccine and each individual type of reaction that people can have, whether they're severe or mild. But from the perspective of vaccine hesitancy, notes that I have. There we go. The vaccines, okay. So vaccines have saved lives and prevented the spread of deadly infections in Canada and around the world for more than 50 years. Vaccines help lower your risk of infection by working with the body's natural defenses to develop immunity to disease. Some diseases that New Brunswickers have been inoculated against, like polio, have disappeared from Canada, and others like rubella and diphtheria are now rarely seen because of long-term high rates of vaccination in the population. Canada has a very rigorous scientific review system in place to ensure vaccines are safe and effective in preventing the diseases they target. And Health Canada has authorized the vaccine after an independent and thorough scientific review for safety, effectiveness, and quality. And I mean the Pfizer and Moderna vaccines. And there are 7 in total that Health Canada is looking at in terms of being able to approve. Even after vaccines are authorized for use, their safety and effectiveness are regularly monitored. So we have a robust surveillance system in place for reporting and monitoring adverse events, and any issues or concerns that are brought forward in that manner, again, we report them at the provincial level and at the national level. And again, that data is captured, and it exists online right now. Prior to the pandemic, it was captured. Their safety and effectiveness are also checked by Health Canada scientists, outside experts like university researchers and Public Health Agency of Canada and Public Health New Brunswick. So we actually have an immunization committee, again, prior to the pandemic, that would review new vaccines that are available every year and decide which ones would be put on our formulary and then put into the budget process. When it comes to the COVID-19 vaccines, we do know that in addition to the work in Canada, they are being approved through separate but equally rigorous processes in other countries. And again, between Public Health Agency of Canada, CDC, et cetera, there are many organizations around the world that we're looking at. Now, with respect to the variants, people are asking, well, is the vaccine going to work? The Government of Canada is closely monitoring that situation with respect to the genetic variant of the virus that causes the COVID-19 that's identified with the United Kingdom. And it's working with international partners, including the World Health Organization, to better understand this variant and its impacts. Genetic variations of the virus, of viruses such as the one that causes COVID-19, are to be expected, so we're not surprised to see mutations that happen, and they have been previously observed in parts of the world this year. Now, while early data suggests that the United Kingdom variant may be more transmissible to date, there is no evidence that the mutations have an impact on the symptom severity, antibody response, or the vaccine efficacy. But specifically, we know that we're seeing higher transmissibility. So again, let's say you were a COVID-19 positive patient and you would normally have possibly infected 3 other individuals. At this point in time, with that variant, you would infect probably 7 people instead of 3. So the antibody response or the vaccine efficacy is not affected. So the evidence, however, is limited at this time. So more research is going to be done here in Canada and around the world. And that's all I have to say about the vaccines for now. Thank you. Merci.
Ladies and gentlemen, mesdames et messieurs, voilà la fin de donc mise à jour. Merci beaucoup. That concludes today's update. Thank you.